The City Council also has another plan in the works, and this one could wipe out your unpaid medical bills. Meg Ferris joins us live now from UMC with this exclusive report on how all of this would work. Meg.
And Devin, this is a plan that could help some people not have that debt anymore from long-time medical bills that they just can't pay. And it's a plan that can also help the hospitals and doctors' offices and clinics get some of the red ink out of their books. One major illness or trauma can be life-changing, and not only to your physical health, but your financial health as well. Nationally, 4 of 10 adults in the U.S. have medical debt. 56% of Black adults have medical debt.
Medical debt like this can impact your credit. So if you're looking for housing opportunities, things like that, you're looking to buy a car, it can impact your credit.
So New Orleans City Council President Helena Moreno is bringing an idea used in cities in Illinois and Ohio to New Orleans. Thursday, the council will take up using a small part of federal funds from the American Rescue Plan Act to pay off some of the debt that Orleans Parish patients owe to hospitals and doctors' clinics.
Just because you get sick or because you get injured, it shouldn't put you into debt or cause you to go broke. And so there are many people in the city of New Orleans who are in that situation.
I have seen people say that they will not go to the doctor because they're scared of the medical bill.
Dr. Corey Hebert says skipping regular checkups actually makes things worse.
If you don't pay up front, you will pay exponentially more in the back end. Using this to alleviate people's medical debt is a great thing.
It will take several months for the city and nonprofit company to work out the details of who qualifies for medical debt forgiveness. And the debt owed will be bought for pennies on the dollar. So it's estimated 1.3 million of the funds will cancel about 130 million in medical bills. But what about other pressing needs in the city, like crime and police?
I can tell you that the overwhelming majority of that $75 million is going toward public safety. But that doesn't mean that we can't use these federal funds for other major initiatives to help the city of New Orleans. And $1.3 million out of this first $75 million tranche, when we still have another $75 million that we haven't even touched, I think is a wise investment.
Okay, and I spoke with Ms. Dinkler, who is the CAO of the LCMC Health, those 6 hospitals, and she says this is an innovative idea. It's going to help people with the burden that they have because that impacts their psychological and physical health. And she said, of course, health care is not a luxury item that people buy. Now, it's going to help the providers who also have debt on their books, but it's unclear at this time if this is going to help with the charity care costs that hospitals just absorb at this point. Reporting live from UMC, Meg Ferris, Eyewitness News. Back to you, Devin.